If you've been considering breast augmentation, you would need to decide what type of implant you want. You'll need to choose between saline or silicone, smooth or textured shells, and whether you want a round implant or an anatomic shaped implant. Both saline and silicone implants are made from silicone rubber shells, but are filled with different materials. The saline implants contain salt water, and the new silicone implants contain a jelly-like cohesive silicone filler. Many women are concerned about the safety of silicone because of all the controversy in the media back in the early 1990s. However, after extensive clinical trials, the FDA re-released silicone implants for general use back in 2006 because they found that silicone and saline implants were both safe. The benefits of saline implants include a smaller opening needed to insert the implants, easy detection if they leak, and a lower cost. The main downsides of saline implants is that the feel is not as natural. The appearance tends to look more artificial, and there's a higher tendency to show visible rippling. Also, for saline implants, we typically put them under the main muscle of the chest to try to hide the rippling in the cleavage area. I'll discuss more of this on the video that explains positioning of the implants. The benefits of silicone include a more natural feel, a more natural appearance, and less tendency toward rippling. Also, silicone implants can be put either under or over the pectoral muscle and look good in both positions. The downsides of silicone include a slightly larger opening needed to insert them, difficulty in detecting leakage, meaning you would need to see a radiologist to help you with an MRI scan or a high-definition ultrasound, and a higher cost. If your silicone implants are found to be leaking, don't worry too much. There have not been any links to disease or cancer, but we do recommend that they be replaced because there is a chance that silicone droplets could migrate and cause lumpiness, tending to extend toward the underarm. The good news is that the saline and silicone implants that we use come with a lifetime warranty from the manufacturer. Feel free to contact us about details. Implants come in smooth or textured shells. Textured shells look like someone sprayed fine rubber sand on them. The idea behind the texture was to try to reduce the incidence of capsular contractures. What that means is that every woman's body makes a capsule of scar tissue around the implant. That's normal and good because it stabilizes the implant. What's bad is that for reasons we don't quite fully understand, sometimes the capsule will shrink around the implant and cause the breast to become firm and take on more of a spherical shape. Some studies show a lower incidence of capsular contraction with textured implants, while others show virtually no difference. I prefer the smooth shell implants because they feel softer, last longer, and have less complications associated with them, such as post-op seroma formation. Seromas are excessive fluid pockets around an area where surgery has been performed. Your body creates this fluid typically due to irritation. Textured implant shells tend to irritate the surrounding tissues, which leads to seromas. I have seen this very commonly in athletic or very active women with textured implants. In addition, smooth implants also tend to look more natural, move more like a breast normally should move, and only very rarely have associated seromas. As far as round implants or anatomic shaped implants, I prefer the round shape. The anatomic implants, which have a little more of a pear shape, only come in textured shells and are more expensive and have a higher leakage rate and have higher complications associated with them, such as post-op seroma formation, as I mentioned before. I appreciate your interest in breast augmentation. If you need more information and want to speak to me or our patient coordinator, please do not hesitate to let us know. We are more than happy to discuss any of your questions or concerns.